Morning Line, our guest with us this morning, Clint Kelly, medical malpractice attorney. We can take your phone call, 737-7587. A couple more segments with him. And all right, Clint, you've got some images here. That one jumps out, right? And we'll try to hold it in front of Clint, and maybe they can take a shot of that, but we can describe what that is if you take a single shot of him.
Yeah, this is the case of the surgical souvenir, which was...
Hold it up a bit there. There you go. And it's like
that way.
Yeah, you can see there's a scissors. Is that in someone's
abdomen? Yeah, the hemostats. This was an X-ray image that was taken of someone's lungs, and the doctor who operated on this patient left the hemostats inside the patient's.
Yeah, she got with the other camera. Yeah. So
it was called the case of the surgical souvenir, and these cases, believe it or not, they're far more common than people like to know, because oftentimes they're not found.
Wait, so this guy walks out of the hospital with that in his lung?
Correct. He had a well, not in his lung. It was down below his lung, but he had a pulmonary procedure, and you'll see where this thing's found. It's down towards the pelvis, where the doctor was working. He left these hemostats, and they fell down towards the pelvis. This patient showed back up because he was starting to have pain, abdominal pain.
Like, this hurts. What is that?
Couldn't figure out what it was. He was taking, Tums and all types of, thinking it was indigestion. Goes and sees his gastroenterologist. Gastroenterologist did a colonoscopy, couldn't find anything wrong with the guy. He's like, I can't figure out what this is. And just by circumstance, when he was in the emergency room because he was hurting so bad, he was keeled over, they decided to do an X-ray and found this. So
can you imagine when they see that? All right, so they're thinking this is an emergency. This is not who left it there. Right. They're like, oh my gosh. How much later was this after the surgery?
3 years.
3 years that was in there.
Yeah. Yeah.
So what happens in the case? Like, what happened? Do you know how the resolution was?
Yeah, I read about this. This guy obviously filed a claim, and it was settled out of court. And the thing about the statute of limitations is, obviously, he didn't discover this until the 3rd year. So the statute doesn't begin to run until he discovered it. But I've had cases with sponges left in people. I've had cases where the suture, the needle that sews in the sutures oftentimes are curved. Seen those, they're metal, seen those left in. They've shown up in someone's back. Seen intrauterine devices that have gotten loose. Marina litigation was about that. Marina made these intrauterine devices. They came loose. They were
did a story on some of those.
Being found. But anyway, this is one of the more common types of negligence. The question is this. Do you remove it? Now, this guy, clearly you do because it was causing his symptoms, but there are occasions where sponges or needles are left in the patient's body, and it makes more sense to leave it in the body than it is to take the risk to remove it.
Do they have a case if there's a sponge that's not needed to be removed? Because what's the damage?
You just asked the question. That's the tough question to answer. Now,
I mean, it's clearly negligence that you leave something in someone's body.
Correct.
But how would they have discovered?
To answer your question, there is a claim.
Okay, there is a claim.
There is no question.
But what are the damages?
But what are the well, and some patients are like, I want this thing out of me.
Yeah, because it's psychological. I mean, I've got a sponge in my abdomen that shouldn't be there.
Right.
Whether it's hurting you or not, I think that would affect you psychologically.
Correct. Other patients will say, look, I don't want to take that chance.
You don't want to go under the knife again.
I don't want to go under the knife again, but hey, this has been done to me. Yes, there are damages for that. You have a claim for this, but this happens far too often.
When they discover a sponge that doesn't need to be removed, how do those get discovered? Is it just by happenstance you're getting x-rayed for something else? Hey, what the heck is that? Because if you're not complaining about pain, they're not looking for something at that point, right?
The case that I had where the sponge was found, it was actually an infection. The patient developed an infection, intra-abdominal infection, and they were in there trying to debride the infection, and they found a piece of the sponge sticking out where the infection was. How about that for weird?
How does that happen when, you know you're going to say negligence, they weren't paying attention. Whose responsibility is it to make sure the wound is clear of all utensils? Is it the doctor or is it a nurse assistant? Who typically is supposed to say, make sure you clear that all out?
Doctor and nurse.
Okay, so both of them, they're all responsible because they're both looking at it.
They do what's called a sponge count.
Okay.
So at the conclusion of the procedure, both of their job is to ensure that the number of sponges used add up to the number of sponges removed. And they're both responsible. Now, from a practical standpoint, nurses are often more involved in doing that than the surgeon is, but the standard of care is both are supposed to be doing this to ensure that this doesn't happen.
You know, a small sponge I can almost understand. It's going to happen. It's no excuse. But a scissor, or what'd you call that? Hemostat. Come on. A hemostat left in your abdomen. I mean, how do you not see that sitting there? It looks just like a scissor.
They're supposed to do an instrument count. Okay, so that's part of the procedures to make sure whatever instruments you use marry up to the instruments that are pulled out of the body. So again, this is not hard to find, but remember what I told you, this is assembly line medicine these days. The margin for error continues to shrink because the volume of patients having surgery meets a limited number of surgeons who can do it, limited number of OR suites, and so there's only so much time you've got to make sure that these counts are done properly.
Talking about all the different kind of surgeries, we can look at some other images here in a sec, but I remember there's a case you and I did, I think, with regard to cases involving breast implants, or, you know, whether or not, I thought that was a case once we did a long time ago, and how often this happens now. If you get any kind of surgical augmentation, whether it's an implant on your breast or whatever, I think this was one case where a doctor on his own decided to do some more surgery beyond her, end up giving her a larger implant than she asked for, or something like that, that created problems. Sometimes, I guess what I'm going at is, how often does a doctor just freelance sometimes and say, well, she wanted a C, but I'm going to give her a D, something like that?
It's not often, but it does happen. And I'll tell you why it happens most of the time.
Okay.
There's a miscommunication between the doctor and the patient as to what the scope of the procedure is going to be. And at the end of the day, it's the doctor's job to make sure that the patient understands what's being done, okay? And patients sign off on these things, okay? There's informed consent specifying exactly what's going to be done so that the doctor and the patient are on the same page. The problem is sometimes the doctor does not explain things very well to the patient, and you'll get a screw up like that.
Something different like that.
Correct.
Yeah.
But you know, and that can be fixed. Oftentimes that can be fixed.
Right.
The problems that you have are where the patient does not authorize a certain procedure and the doctor does it anyway. And I've had a number of those cases where a patient will say, I want to have X surgery, and the doctor does X plus Y. And it turns out the Y part of the procedure is the one that hurts the patient the most. Inexcusable. It's against the law. It's called battery. And those are cases that patients can get compensation for.
Okay, it's using those words, some of your cases can turn criminal.
Close. Close.
Some, okay.
The only one that I've had that was criminal, and we've talked about this before, was a doctor who was drunk during surgery.
Yeah, and that should be criminal.
That was criminal.
Under no circumstances.
The other ones are, they can be criminally reckless, but would I want a crime being charged over? Probably not, because those were cases the patients were compensated and compensated well.
The most high-profile criminal case we had locally was the nurse at Vanderbilt.
I know.
Madame DeVos. We've talked about that at length, which, you know, it's now in the rearview mirror, but, you know, I guess they were talking about, again, this next legislative session, looking at qualified immunity for nurses.
Yeah, I mean, as much as I don't like qualified immunity for nurses, I don't like prosecution either. I mean, I'm a believer that you leave the door open for the right case for this to happen, if it needs to happen. And there should be considerable discretion used before you make that kind of prosecution because of the chilling effect it can have. I told you, I don't think this is going to happen again.
You said that all along.
I mean, have you heard of one lately?
No, it's a very rare case.
I mean, I think that the public sentiment from this was such that it's had its effect. It's chilled a lot of other prosecutors from bringing claims like this because it's
people didn't like it. Yeah.
Yeah.
Do you think it had a real adverse effect on whether or not people choose to go into the nursing profession? I mean, there was some talk of that initially, and there may be other reasons why you don't want to go into the nursing profession, but I don't see personally, some of what I've done research, that this Vought case all of a sudden, you know, has continued to have legs and deters people from going into the field.
I talk to nursing experts frequently, and none of them have ever told me that they're having trouble either recruiting or having people show up for work because of the Redonda Vought case.
I just don't
Let me tell you what gets
out.
them upset when they're not paid properly, or they're overworked. That's the kind of thing that makes nurses burn out and say, I've had enough. But Vought, I think, was more of a Vought was more like a slap in the face than it was
exactly.
You know,
so it was like an aberration. But the other point is, as opposed to a slap in the face, a long, drawn-out chronic thing was the way nurses were overworked during COVID.
Correct.
I mean, we saw what was happening with our frontline medical workers when so many people were sick, and it was the worst, and they were, I mean, overwhelmed.
Look, I'm a firm believer that nurses should be paid a lot more money because they are the horsepower of the healthcare system.
Well, they're being used now more than ever before by the doctors, right? It seems like sometimes, one time I was there and I'm like, am I talking to the doctor or the nurse here? And, well, I'm the nurse practitioner.
I guess who's the first to get blamed, Nick, when something goes bad?
The nurse.
Of course. It all runs downhill. So, I mean, I just believe that nurses should be paid more money by hospitals, and because they work harder, frankly, they're more diligent, and the healthcare system absolutely depends on a strong nursing corps.
Let's take a call from Carl. Carl, good morning. Hi, Carl.
Hey, hello. How are you?
Good. What's on your mind, Carl?
Well, I just got a question, or what if, I guess.
Sure.
I had problems with MRSA due to knee surgery.
Mm-hmm.
And the medicine that they gave me, the IV medicine, vancomycin, shut my kidneys down. And in the process, my MRSA returned. I ended up being on dialysis for about 7.5 months. And somebody dropped the ball, but I don't know who. And I tried to get help. And of course, it's been over a year, so I know there's nothing can do. But is that something that is that considered malpractice, or what's the deal? Someone forgot to do a weekly check on my blood. Failed to do a blood profile.
Well, it's interesting. You and I've talked about this a lot, that infections are part of the risks of the procedure when patients have surgery.
Germs in hospitals.
Correct. And MRSA's the worst, all right? It is hard to treat. Vancomycin is one of the proven ways to deal with it, but vancomycin also has side effects, which is what Carl's talking about. But when you talk about the blood testing, I think what Carl's talking about is, should somebody have been monitoring him to see if he had the infection? Because infections leave clues. Elevated white blood cell counts are always the most important clue. When you have elevated white blood cells, that's your body, it's fighting something. So you want to make sure you have your blood tested regularly, because the sooner you get to the MRSA with the vancomycin, the faster you can get it under control, and the less time you have to spend taking the vancomycin. And vancomycin can certainly have a deleterious effect on your kidneys. So would you have had a case? Possibly so. And I've always said, 9 times out of 10, the negligent act is not getting the infection, because that's a risk of the procedure.
Right.
The negligent act is failing to diagnose it and treat it promptly.
So delayed diagnosis.
Delayed diagnosis.
Not necessarily misdiagnosis.
Yeah, it's usually delayed. It's not somebody calling one thing or another. They just failed to do it in a timely manner.
Delayed. Okay. What MRSA, and what are some of the other infections you get in the hospital? Is it just this?
Well, MRSA is a form of staph.
Staph, that's right.
Pseudomonas. Yeah. That's the one that stinks real bad. Gangrene. You can get necrotizing fasciitis.
I was about to bring that one
which
up.
You can lose a limb in 24 hours if you're not on top of it quickly. Again, that's an infection where you can get it from I had a client that broke a pot out in her front yard. She was gardening. She got scratched on her leg, and she started swelling where her leg was. And so, thank goodness, she went to the emergency room, and they were treating it, and they didn't diagnose the necrotizing fasciitis when she had obvious signs of infection. 8 hours later, her leg is turning black and stinks to high heaven. They go in there and open it up, and by the time they've made the diagnosis, start treating it, she loses her leg right above the knee. They amputate it.
So now, that was a case?
And that was a local hospital. They just blew it.
They did blow it. I mean, she just got scratched by a pot. So obviously there was a bizarre germ on there, and it got in there.
Yeah, it's one thing when you get a scratch. Like, okay, when your knee starts to swell up the size of a volleyball, and it looks like there's fluid inside there, and you have massive pain, and it's warm to the touch. It kind of has that red warm to the touch feeling. Something's going on in there. This isn't just, I just got scratched. And that's what was happening. This infection was introduced when she got scratched, and it just took off. They're like Green Berets, man. They go after everything. And if you can diagnose it quickly and start treatment, you can usually preserve the limb. But if you blow it off or don't find what it is for 8 to 12 hours, you lose your limb.
And with necrotitis, that goes so fast. Yeah. You have a matter of, and had they not, amputated, it would have spread.
It would have killed her. Yeah, it would have killed her. Wow. That's how quick. That's what they do. They you know what they told her, Nick? They said, "It's your leg or your life. You pick."
I guess
because she didn't want to lose her leg for obvious reasons.
She was very upset about that. But it's like,
it's your leg or your life, because they have to chop it off where it is out of control. Okay, in other words, chop off the Green Berets, and then begin to debride and clean it up where it was cut, so you can keep it from migrating the rest of the body. Once it gets into the bloodstream, which is called sepsis, you're dead.
And that, just that thing, that's scary. You hear about people maybe getting scratched by a cat or a little thing like that.
Yeah.
So you would say,
What
and again, I know you're not a doctor,
actually,
but you see these cases, you get a scratch and you see something develop. And we've all had infections maybe that get a little nasty, you put some Bactine on it and they heal up. The difference is, you'll notice real quick. You'll know if it's out of control.
Yeah, public
right?
service announcement for anyone who ever gets scratched and it seems like something innocuous. You start getting swelling around the area, you start getting like pimples or pustules around it, it feels kind of warm, sort of a clammy, warm feeling to the touch, different from the surrounding tissue. Go to the emergency room. Just go. Maybe it's nothing. Maybe it's cellulitis or something, no big deal. But it is possible it could be necrotizing fasciitis, and you may save your limb if you do it.
No kidding. My brother got bit by a cat in his thumb. Now, cat bites are the worst. They're dirty as can be. He went to bed, woke up the next morning, almost lost his thumb, was on antibiotics for like 3 months, and just horrible infection. You get bit by a cat, don't wait. Go to the emergency room. Yeah. All right, we'll take a break. When we come back, our final segment, a few more phone calls, more of our conversation. This is great morning fare. I find it fascinating.
Public service messages abound today.
Hey, listen, I learn something from Clint every day. We'll be right back right after this. Stay with us.